Please start.
So, very good afternoon to all the viewers all across India. On behalf of Indian Academy of Neurology, I welcome you all to this patient awareness session in epilepsy conducted on the occasion of National Epilepsy Day. The National Epilepsy Day is observed on 17th of November every year with the main aim of spreading the awareness about the epilepsy. And this year, Indian Academy of Neurology, which is a umbrella organization of neurologists all across the India, has taken the initiative to hold this panel discussion for patient awareness in each state and each local language. So we have conducted 28 sessions in 20 different languages of India. And now, as a part of the same initiative, we are doing this in English language from the central team. So briefly about epilepsy, epilepsy is a common neurological disorder and it affects almost 1% of the population. And similar to the other neurological disorder like headache, stroke, or Parkinson's disease, it is a common neurological disorder. But in spite of being so common, there are many misconceptions and myths which surround the epilepsy, especially in the general public. And in spite of the fact that majority of the people with epilepsy can live a normal life with proper treatment, many people believe that epilepsy is not treatable. They do not seek treatment. Many people think that it is because of the divine intervention. Other people think that medicines are causes significant side effects and problem, and because of which prevents those people to seek a proper medical care and which causes impairment in their quality of life. To remove some of this misconception and myths, we have organized this panel discussion all across the country. And it is my good fortunate to introduce you to the eminent panelists today who have agreed to join us from all across the India and some of the prominent neurologists and epilepsy experts from the country. First, we have Professor Radhakrishnan, who has been one of the senior most neurologist and epilepsy expert in the country. And we can call him the Bhishma Pitamaha of epilepsy in India. He has been the director of prestigious Sri Chitra Institute in the past and worked from the grassroots level to the advanced treatment of the epilepsy. So we welcome you, sir, on this panel discussion.
Thank you very much.
We have Professor Sangeeta Rawat, who has been the HOD of the neurology at KM Hospital and now the Dean at same hospital, and also the President of Indian Academy of Neurology. Madam has working in the field of epilepsy for last more than 30 years and established one of the well-known epilepsy surgery center in the Western India. So we welcome you, Madam, also to this discussion. We also have Dr. Mamta Bhushan Singh, who is a professor of neurology at All India Institute of Neurology, working in the field of epilepsy and has particular interest in working with the rural community in the epilepsy through the Lifeline Express and has traveled to the remote corners of the country and seen the problems experienced by the epilepsy patient firsthand. So we welcome you, Madam, also this panel discussion. We have Dr. Ashima Nehra. She is a professor of psychology at All India Institute of Neurology and counseling and managing people with epilepsy all across India for the last 30 years. So thank you for joining, Madam, and we welcome you.
Thank you. Thank you so much.
And we will also have Dr. Malla Bhaskar Rao, who will be joining us. Bhaskar Rao, sir, is a prominent neurosurgeon, senior neurologist surgeon, neurosurgeon who recently retired from the NIMHANS. And we can say that he has been the pioneer of epilepsy surgery in India and one of the first surgeons who started surgery for epilepsy in India. And he has been working for last almost 30-35 years. So we will be welcoming Malla Bhaskar Rao sir also. The session is mainly aimed at improving the awareness of the epilepsy, and we will start with the basic question about many people usually ask that what is epilepsy and how does it occur? So we will take the help of Professor Radhakrishnan to understand what is epilepsy, what is the difference between a seizure and epilepsy, and how does actually epilepsy occur in the brain. Sir.
Thank you, Chaturbuj, and thanks for the opportunity. Epilepsy is defined as a neurological condition with a predisposition to develop unprovoked recurrent epileptic seizures. So first of all, we have to understand that what is an epileptic seizure. While epileptic seizure is a symptom, epilepsy is considered as a disease with that predisposition to develop epileptic seizures. Now, the brain is nowadays conceptualized as an electrical network, or you may say that it's a kind of computer, the most complicated computer network one can envisage. So whenever there is an electrical disturbance in the form of short circuiting within this network, it presents varied manifestations or symptoms, which you're going to hear in as an answer to one of the subsequent questions. Now, this tendency to develop short circuiting is more often genetically predisposed, but it can also occur as a result of an acquired insult to the brain, which that means there are different causes for epilepsy. Either you are born with a brain which has got a tendency to short circuit for trivial reasons and develop recurrent epileptic seizures, or it may be acquired subsequently related to a brain insult, which may be in the form of head injury, stroke, or the infections, and all these things can again result in epilepsy. That, in short, is how nowadays we understand epilepsy as a disease and epileptic seizure as a symptom of that particular disease.
So we can simply that we have to understand that seizure is one symptom, while epilepsy is disease where the patient has recurrent seizures. And usually it is caused by the electrical disturbance in the electrical circuit of the brain. So in a simple language, we can tell that whenever there is like electricity and there is a short circuit. So similarly, if there is a short circuiting in the electrical activity of the brain, it causes the seizure, and subsequently patient have recurrent seizure, then it becomes epilepsy. So we will understand what are the different causes of epilepsy in subsequent. But now this is what is the underlying problem. But how the patient usually present with the seizure, what are the common symptoms of the seizures? So we will ask Dr. Sangeeta Rawat, madam, to really explain what are the different symptoms which a patient can present, and how a person should recognize that these are patient is having epilepsy.
So thank you, Chaturbuj. It's that there are many different ways an epilepsy can present. So first of all, in epilepsy can start in one part of the brain, then it is called focal seizure. Or it can start in the whole brain together, then it is called generalized seizures. So in generalized seizures, the commonest one is a generalized tonic-clonic seizure, which is also called as a grand mal seizures, in which you have a tonic-clonic movement of the body, whole body, stiffness of body, uprolling of eyeballs. You may have a clenching of teeth. You may have tongue bite. You may have frothing, incontinence of urine, and then patient is unconscious for a few minutes. So this is a most typical, which everybody knows. But then there is called as absence seizure. So this also starts whole brain together, but the symptoms of patient may be just staring at one place, or it may be just blinking a couple of times like this. This is usually seen in children, and it occurs very often in a day. So sometimes the teacher might say the child is unattentive and not studying well, but actually he may be developing this absence seizure. So that is what the parents have to look for it. Then third is you may have a jerk of one hand or jerk of the body, which is called as a myoclonic jerks. And this myoclonic epilepsy can also have absence, can also have a generalized seizures. So same three things can occur in one person. So these are usually genetically associated. Then comes the second part, which is, I said, a focal seizure, where one part of the brain is involved. Now the symptoms depends on which part of from where it is arising. So the first symptom which patient may remember is called aura. So he comes to know that he is likely to get a seizure. So this aura, if it is arising from temporal lobe, it could be abnormal smell or discomfort in the abdomen or ghabrahat, he gets scared and things like that. And then the subsequent symptoms, if it is a temporal lobe seizure, it may be that he have a lip smacking like that. He may have an automatism of like this. He may start just fumbling with his clothes. He may have a blank stare or he may have a searching eye movements. And then he is confused and he may not speak. He may have a speech arrest and behavioral arrest. This is usually stereotypical and lasts for 1 minute or less. Then if it is arising from the motor area of the brain, where the hand and leg motor area is concerned, then it may be a focal jerking of one limb or focal jerking of the face like this. And if it is arising from the sensory part of the brain, then sensory part is that you will have a tingling in one limb or tingling on the face, whichever area is involved. And then comes the occipital area where you may see the visual. So then if you have that visual area, then you may have pictures or halos, colored objects. You may have a nystagmus or a blinking of one eye and eye deviation to one side or things like that. So depending on which area of the brain is involved, you may have a different symptoms. And that's important that people know that there are so many types of seizure. And that's why it is important they recognize these symptoms. So whenever there is a patient is confused and the same type of symptoms are occurring again and again, always think that this could be a seizure and please take them to a doctor or a neurologist or epileptologist to know and diagnose further.
So what we, as a message that what usually people understand that seizure or fits are just the jerking movement of the limbs and falling. So there may be many other symptoms of the epilepsy, and that patient has to recognize. So any patient who has this epilepsy, the two important symptoms are that these are the brief events and these are recurrent events. So they occur repeatedly and very brief period. So if any patient who is losing consciousness or who is not responding to some extent for a even brief period of time and repeatedly, then you think that this is epilepsy. So it's not only tonic-clonic movement or jerky movement, but other symptoms also we need to think of. So now so these are the usual symptoms which the patient present, how epilepsy occur, we have discussed. So we will ask Dr. Mamta to really enlighten us that what are the common causes of epilepsy. And usually people ask that, mera daura, meri epilepsy kyun ho gaya, kaise ho gaya? So we'll ask Dr. Mamta to really elaborate what are the common causes in epilepsy, especially in our country.
Thank you, Chaturbhuj. So just like it was mentioned in the beginning that one needs to differentiate a seizure from epilepsy. So when you consider or think about causes, so there are certain situations, for example, somebody who has diabetes, has very abnormally low blood sugar, took their medicine, did not take their meal, hypoglycemia or a very low blood sugar, somebody who has been repeatedly vomiting and develops low sodium, hyponatremia. These things can lead, or maybe in a child, very commonly, most people know about it, something called febrile seizures. You have fever and then you just have one seizure. So all these don't constitute epilepsy. These are provoked or acute symptomatic seizures. So the causes for these are very readily visible. You know that this person has low blood sugar and therefore had one seizure. So you would not label that as epilepsy. You would call it an acute symptomatic seizure. It just requires correction of the metabolic abnormality, or if there is fever leading to febrile seizure, then just lowering of fever is enough. On the contrary, when you talk of epilepsy, then you don't have an immediate cause. So here the seizures are called unprovoked, which means that there is a condition in the brain which is leading to recurrent seizures, but there is no immediate proximate cause for that. So what can these causes be which leads to epilepsy or which leads to unprovoked seizures? So these causes vary depending upon the age of the patient. Certain causes are more often seen in very small newborn babies or infants, others in older children, and adults or middle-aged people have epilepsy due to some other causes more often, and in the elderly there are typically some causes which are more common in the elderly. So it is important to understand that anything which leads to brain damage of any kind uh, has the potential of causing epilepsy, so which practically includes all diseases of the brain. Now, if somebody, for example, has had head injury, if you have had severe head injury, and with some treatment over weeks to months, the person may normalize otherwise, but the injury would have left a permanent scar in the brain, and that can be a cause for recurrent seizures over the years, and this now is called epilepsy. Similarly, somebody who has experienced a stroke can happen at any age. You can have it in a small child, in a young adult, in an older person. So the aftermath of the stroke, or the sequelae, or the residual scarring of the brain that is left after a stroke can lead to recurrent seizures or epilepsy. Brain tumors can cause epilepsy. If there is, at the time of childbirth, this is very common in our country, if there is hypoxic brain damage, so there's a history of delayed cry at birth, the milestones have been delayed, then in addition to the other deficits that such children may have, they may also have a predisposition to recurrent seizures or epilepsy. Infections are very common in our country. So whether it is TB of the brain, or it is some kind of meningitis, encephalitis, and very common, especially in North India, the condition called neurocysticercosis, or in simple terms, having some kind of a worm in your bowel, and then accidentally the eggs, or some life cycle of that worm reaches the brain, and that is a frequent cause of seizures, especially in North India. Then you can have some structural abnormalities, which again may be present since birth, but may manifest with seizures at any given age in younger people, or sometimes in older. And a very small minority in our country have causes that are genetic. So this in summary would be the various causes of epilepsy.
So basically, people have to understand that every seizure is not epilepsy. Some of the seizures may be due to the correctable causes like low glucose, and that is can be easily corrected. And then there are causes which causes recurrent seizure, which Dr. Mamta has mentioned. And any kind of brain injury can cause seizures. And it is neurologists who will decide or define really what is the cause for epilepsy. We have to understand that in many patients, approximately 50-60% of the patient, we may not be able to find a definite cause. And in those causes, we usually consider that it may be related to genetic factors, or it may be certain cause which we have not been able to delineate. So even if we have epilepsy, there may not be any particular definite cause in many patients, which we need to understand. So these are the what we causes and diagnosis, symptoms of epilepsy. Now, the patient who comes to the clinician or a neurologist, so how we diagnose epilepsy. So we will hear from Dr. Radhakrishnan how the epilepsy is diagnosed and what are the different tests which helps us in the diagnosis of epilepsy.
Yeah, first of all, one should understand that epilepsy is a clinical diagnosis. Whenever you go to a doctor with any disease, first of all, he takes a history and subsequently makes an examination, and we call it symptoms and the signs. In majority of patients with epilepsy will not have any kind of signs, so that the diagnosis is almost exclusively dependent upon history. So from the patient's perspective, it's very important to provide the doctor with a very clear-cut history. And the history, the doctor also should obtain the history not only from the patient. Many times there will be an impairment of awareness of the patient, and we may not be able to understand what has happened to him. So an eyewitness account is the one which clearly gives the diagnosis. That's perhaps the most important, the method with which we diagnose epilepsy. And here one should depend upon that eyewitness account, depend upon how carefully somebody has observed it. And many a time There may be, suppose there are 4 persons who have witnessed a patient, there may be 5 or 10 different opinions they may be providing you with. But nowadays, it is also most of people ask about what is the most important kind of technological advance which has happened in the diagnosis of epilepsy in recent years. It is simply not the sophisticated kind of test and other things. It's a mobile phone. So that we can utilize it very effectively nowadays, which is since this talk is mainly meant for the patients and their caregivers. It's important for you to capture some of these events in your smartphone video and take it to the doctor when you go, which are largely simplified and made the diagnosis of epilepsy very accurate. And then try to capture as many number of events as possible. This will help us to decide about whether these manifestations which are happening are stereotyped, are they the same, are they different? This again is one particular aspect of the epilepsy. Now, there are investigations which can support and further refine the diagnosis of epilepsy, what you have already made clinically. And the most important one is to, as I mentioned, epilepsy is an electrical disturbance of the brain. Just like you record the ECG for the heart, we record the EEG for the brain, electrical disturbance. And having told that, EEG is a very complex and investigations which has to be correctly done and correctly interpreted, so that one has to always review this investigation based on the expertise with which it has been reviewed, unless the doctor has got a chance to review the record. And the other investigation, which to find out the causes, which Mamta has already told you, is to do a structural imaging, which nowadays called the magnetic resonance imaging of the brain, which can detect the lesion or any focal abnormalities in the brain, which can tell us about what is from where the epilepsy is originating and what is the reason for it and all. There are a lot of advances, as Chaturbhuj mentioned, that nowadays in majority of instances, even when the epilepsy is as a result of an acquired lesion, you have to have a genetic predisposition or genetic tendency to develop a recurrent seizure. So that many times nowadays we do the genetic investigation much more than we were doing in the past, because this is coming up in even in the acquired epilepsies, that whether you're born with a genetic predisposition, because the question to ask is that 10 people may be getting a head injury, out of which only 2 develop epilepsy. So what distinguishes between these 2 who developed epilepsy and the 8 of them who did not develop it? It's a kind of predisposition to develop it. So that these are in short the way, and depending upon, as epilepsy has got a variety of causes, depending upon whatever is the initial evaluation, further investigations may be done in order to pinpoint the reason for epilepsy.
So to summarize that, history or what is the eyewitness account remains the most important test or tool to diagnose epilepsy. And please remember that every patient who is becoming unconscious or falling ground doesn't have epilepsy. So there are other conditions which can mimic epilepsy. So that can only be diagnosed through the proper history. And then we have a EEG and MRI. And then there are other tests, basically EEG and MRI, which are usually done to diagnose epilepsy. So once we diagnose, now comes to the treatment. So we'll ask Dr. Sangeeta that how the epilepsy is treated and how do we start medicine, how those medicines are managed. So just, Madam, tell us briefly about the overall medical treatment of epilepsy.
So I think, as Dr. Radhakrishnan said, first and foremost, we have to establish that it is a diagnosis of epilepsy and it is not just a provoked seizure. If it is a provoked seizure, you don't have to start medical management with anti-seizure medication. So once we diagnose it is a epilepsy, then we have to decide for the medical management as the first line of treatment. So the choice of anti-seizure medication depends on age of the patient, gender of the patient, type of epilepsy syndrome, and also apart from that, what is the occupation or what is the lifestyle of the patients, and all that and comorbidities in the patient, whether the patient is elderly, has diabetes, has all those things. So after taking into all these factors, then the neurologist decides to start on drug. So the important thing is first always start one monotherapy drug. Start with a low dose, gradually increase the dose so that the side effects don't occur. Once you increase the dose, go up to the maximum tolerable dose of that monotherapy. If the patient seizures are controlled fully, then you have to continue with that. If they are controlled partially, then you may add another drug to control fully. But if there is no response, then you may switch to the another drug. So either a substitute or an add-on. So once you do that, patient usually goes into polytherapy. So that is more than one drug. But preferable is try with monotherapy. So once you go to the polytherapy, again, the second choice of drug depends on the various factors which I've told, but also apart from that, the mechanism of action of various 22 anti-epileptic drugs we have. So all these have a different mechanism. So if you are choosing one drug from one particular type of group with some mechanism, choose the second drug with the different type of mechanism. So once you have chosen that drug, patient is put on the drug, it's important that you look for side effects. You inform the patient what could be side effects. So important is if there is a rash or anything like that, patient has to stop drugs immediately, even before he consults you, and then comes and consults you as soon as possible. So these instructions you have to give. And then comes the side effect of, usual side effect of dizziness, drowsiness, and also you have to inform patient that you may get this. Yeah, you may get this, and if you get it, don't stop it. Gradually they'll go. To titrate it, you have to do some of the older drugs can be done as the serum levels of the drug, so that compliance also can be tested. Whether the patient is taking regularly, the blood sample is given as the first morning sample before taking the dose. So we have a range. If the range is in that, depending on that, you can titrate them. So that's how you continue, because it's a chronic disorder, long-term medication are required. So these are the things which you need to follow up with your neurologist.
So for patients, basically, we can highlight that the first line of management in all the patients with epilepsy is through the medicines.
Absolutely.
And as like similar, when we treat a patient with hypertension or diabetes, we have to titrate the dosage of the medicine. So suppose a patient is started on medicine, your doctor starts on medicine, and if there is a seizure recur, that doesn't mean that doctor has done a wrong thing or medicine is not effective or it's not a proper medicine. Probably you will require to change the medicine or increase in the dose. So in those cases, even if seizures are not controlled, please go to your doctor and discuss with that so that medicine can be changed or doses can be altered. And in that way, usually with proper titration, majority of the patient can be controlled with the epilepsy. But patient usually have a lot of apprehension about the taking the medicine, and they are really fearful about the side effect of the medicine. So, Dr. Mamta, please tell us that how safe are these medicine, and are there should be a cause of concern for patients?
So you're right. Patients do express frequently, sometimes don't tell the doctor, but they often harbor very serious concerns, especially because, the medicines have to be taken for very long, for many years, sometimes even, they can never be stopped. So along with that, and then generally patients are talking to neighbors, family, friends, and now you have the internet. Google is also showing them things which causes worry. So it makes it very important for all of us who treat epilepsy, and also for the patients listening to us, to turn to your doctor with your concerns so that you can get reliable, correct information as far as side effects and safety of the anti-seizure drugs is concerned. We should realize that before any drug is made available for clinical use, it has been through extensive preclinical studies, sometimes animal studies. So even before it has come to the patient, there has been an extensive study. And after that, clinical trials, there are phase 1, 2, 4. And even while the medicine gets released for use in general public, the phase 4 extended trial continues to see what are the consequences, long-term consequences, or problems with any drugs. So this is just to reassure you that there is due diligence being done to ensure that the benefit from the drug far exceeds the risk. Of course, it is also important to understand that there cannot be any medicine, not just anti-seizure medicines, but any medicine which is absolutely bereft of side effects, has zero side effects. That is not possible. Even a tablet of aspirin that is considered so innocuous can cause, GI bleeding. So one needs to understand that there are side effects, but most of these side effects are considered once your doctor decides to prescribe you a medicine. They keep all this in their decision making algorithm. What is the age of my patient? What is their weight? What are the other diseases that they might be suffering from? And you tend to be prescribed a drug which is very, very effective for you, and also at the same time, the side effects are not going to be overwhelming. And finally, there are common side effects like headache, fatigue, dizziness, some stomach upset, feeling a little nauseous, etc. These are common. They are not serious. They can be handled, with just taking some precautions. But there are rare side effects which one should know, which are very serious. For example, a drug rash. When you start a new drug and there is a drug rash, it is a very serious side effect, and you're advised to immediately stop the drug, consult with your doctor. And finally, prolonged use of a drug. There you have to look out for certain specific side effects which are different for different drugs. For example, with sodium valproate, we are concerned about weight gain. And you monitor weight, you eat well, you exercise, and you are generally able to overcome it. And so is it with almost all the drugs which have chronic side effects.
So ma'am, can we say that majority of the medicines are really safe and doesn't cause a major side effect? And even if there are side effects, usually it will be depending upon the dose of the medicine, and your doctor will be able to forewarn you if there is any serious side effect. So that notion that the epilepsy medicines are really causes a major problem, that is wrong. Majority of the medicines are safe and doesn't cause major problem. With that, I think with medical therapy, just maybe one question about the medical therapy to Dr. Radhakrishnan. Sir, we know that first treatment is medicine, but it is often the question of the patient that how long they need to take the medicine. Can medicine cure epilepsy? And can you please elaborate on this duration of treatment and curative aspect of medical therapy? Sir, you have to unmute yourself, sir.
As you have already heard that the first step in the management of epilepsy is starting the anti-seizure medication. But one should also emphasize that the treatment of epilepsy is not only taking the medicine, there are certain lifestyle modifications which are required along with the treatment. But as the most important aspect of that is regular sleep and avoiding alcohol and recreational drugs, and to have a positive mind, a positive approach, and not to get depressed and worry about the disease. These are extremely important as far as seizure control is concerned. It is very promising to note that with the presently available anti-seizure medication, almost nearly 2/3 of the patients, almost 60 to 70%, become seizure-free by the appropriate choice of the medication. And they continue to remain seizure-free with adjustment in the lifestyle also. And once you become seizure-free for a period of 2 to 3 years, then the doctor usually considers whether you can come out of the medication or not. This is usually decided. One should also understand that epilepsy is not a single disease. There are very many different types of epilepsy. We call it epilepsy syndromes, depending upon the symptoms, signs, and the MRI findings, EEG findings, etc. And their long-term outcome varies. So depending upon the type of epilepsy which you are having, the doctor will discuss with you the ways of coming out of the medicine. Usually after about 2 to 3 years of seizure freedom, one start thinking about what we call slowly reducing the medicine and taper off. When you do that, almost 50 to 60% or half of the 2/3 of the patient whom you attempt this medication withdrawal can successfully withdraw the medicine and continue to remain seizure free. So in short, the epilepsy, majority of the people, epilepsy is an efficiently treatable disease, and you can also come out of the medicine in almost nearly 50 to 60% of the patients. Rest of them may continue to have seizures, and their management is going to be discussed subsequently. So that one should remember that in majority of the people, if you define cure of a disease as having no symptoms or signs of the disease and not taking any medication for that, this can be achieved in almost 50 to 60% of the patients, which for any kind of disease is a very positive or a promising kind of outcome.
So it's very promising that approximately more than 1/2 to 2/3 of the patient really can, where epilepsy can get resolved and they can come out of the medicine. So that is a promising aspect, but we have to understand that there are another 20-30% of the patients whose seizures may not be controlled by the medicines. And in that case, sometimes the epilepsy surgery or surgery may be an option. So we have eminent neurosurgeon, Dr. Bhaskar Rao. I already introduced him. So we will ask Bhaskar Rao sir that when the people should consider the surgery for the epilepsy or surgery for the seizures. Is surgery an option, first of thing? And subsequently, we'll take your views on safety and efficacy of surgery. But when you think that usually the people should consider surgery?
So, good evening to all of you as well as the participants of this webinar. So, surgery is not only safe but effective as well as time-tested option. People are often surprised when I tell them that epilepsy surgery is existing for 150 years. Even in India, it is existing for more than 70 years. Only thing is that it works only for highly selected group of people. Usually people who do not respond to medication, and they have some cause for not responding to medicines. For example, during their birth or during having fever and fits in childhood or having any problem like brain infection, part of brain called hippocampus very close to the ear gets damaged, and then that causes frequent seizures which do not respond to medication. So, and again, there is another group of children when their brain is formed before birth, small areas of brain may not get formed properly. So again, those areas, they cause epilepsy which do not respond to medication. So this is the group called drug-resistant epilepsy. Not only there is a lot of disability because of drug-resistant epilepsy, these people are prone for injuries during seizures. Sometimes they have very frequent seizures called status epilepticus, and very rarely we come across people with a condition called SUDEP. If you want to understand more about SUDEP, please do Google search. You will get more information. So these are the group of people who have to undergo a detailed evaluation by a neurologist and epileptologist in a dedicated center for comprehensive epilepsy care. Regarding the timing, usually people who respond to medication, usually they respond to 2 or 3 drugs in various permutations and combinations over a period of about 2 years. But unfortunately, in India, not only in India, even in United States, people wait for a long time, 10 years, 15 years, 20 years trying different type of drugs in different combinations, losing very, very valuable period in their life regarding schooling, about jobs, about social life, about marriage prospects. And so these people should, if their seizures are not responding in 2 to 3 years time with 2 to 3 drugs, then they should approach the comprehensive epilepsy programs through their primary care physicians and their doctors, and then find the cause, identify what is actually causing this problem. Nowadays, the identification with video easy telemetry, where behavior during seizure is recorded simultaneously along with EEG, as well as MRI to identify what is the problem in the brain. These techniques are available, fortunately, in 50-60 centers across India. So they should approach a center which is accessible to them, undergo this pre-surgical evaluation, and then only when they are found to be suitable candidates, then only the epilepsy teams will suggest surgery. The teams will suggest surgery when there is a very high chance of cure or control of epilepsy with the surgical interventions. But surgery, let me assure you, surgery is safe, effective. Please don't worry about the problems of
So,
surgery.
sir,
Yeah.
to summarize that, whenever your seizures are not controlled with at least 2 medicine your doctor had prescribed, you should think of surgery. Surgery is a very good option, but it is in a selected group of patients. And whether the surgery is possible or not, it can be decided after the certain investigations and a thorough evaluation. So this, once your seizures are not controlled with the medicine, please do consider surgery, and consider surgery in a early phase, so that these problems can be tackled early. Surgery is very safe, and with the experience hands like Bhaskar sir, I don't think surgery causes any risk. Usually I tell the patient that risk of surgery is similar to you driving a vehicle on the road. So if you have a risk of accident on the road, there is a similar risk of surgery, and not more than that. And in a selected patients, sir, what is your, and you are one of the most experienced surgeon in India. So usually, what proportion of patients get benefited with the surgery if they are properly selected? So
Almost 60 to 70% of people who undergo resective surgery are likely to get cured, and another 20 to 30%, their seizures will be controlled to a large extent. A very small, minuscule of people who undergo surgical procedures may continue to have seizures, but this is a minority. Maybe about 70% cure, 20 to 25% further control, and then about 5% they're medically resistant as well as surgically resistant also.
So, sir, overall, sir, we can say that in a patient who is not getting control and getting very frequent seizure, even if you give a 70% chance that out of 10, 7 patients will be cured of their epilepsy, and a small proportion, half of them may be able to stop the medicine. That is itself is a very good thing to know. And I think in those selected patient, epilepsy surgery. So message to all the people that, all the patients, that surgery is safe and should be considered when your seizures are not controlled with the medicine. Thank you, Bhaskar sir. So this, what we have discussed about the medical management and this, but epilepsy is not a medical disease. Especially in our country, it is a lot of social disease and social problems also. So we will ask Professor Asima Nehra about what are the usual problems which are faced by the people with epilepsy, and how they can try to overcome this, how we can help them to overcome social problems. So
You muted, Ashima.
Yes. First of all, I'd like to thank you for giving me an opportunity to be part of this panel. And I would also like to welcome everybody who's on board. The common problems that I understand that I can see is that the patients, caregivers sometimes are overboard, and they tend to force the patients to take up certain treatment, which sometimes the patients, especially the educated ones, feel that we've not been asked for, and they've not taken consent from us, and they're forcing us to take this treatment. As you know very clearly, many a times these patients, especially the educated ones, they do a lot of homework. They've gone through the internet and they've studied a lot about it. So they know about the positives as well as the negatives. So they sometimes tend to question us, if we should go in for surgery, should we be giving a consent or not. Besides that, they also feel sometimes the caregivers tend to do something called, we call it expressed emotions. So the caregivers or sometimes the relatives or friends will come and tell them, I think it is because you have seizure, you should not be stepping out of the house. You're causing too much of a burden to your family members. You should stay indoors, things like that. Besides that, we've seen when the clinicians are referring our patients to us pre-surgery, which we follow a technique called the AB technique. A is the pre-assessment, B is the intervention, which is done by the clinicians, and A is again a repeat assessment at 1 month, 3 months, 6 months, 1 year. So what we've seen is that when the patients are coming to us pre-surgically, they need to be given we call it the latest term, which is called the prehab. So they need to be given a rehabilitation. They need to be aware of what we would be doing in case they consent for surgery and in
Madam,
case the surgery is done.
may I interrupt? Probably we are not pre-surgical evaluation. What are the common epilepsy patient? What are the problems that they face, like the social taboo and stigma and this?
Yeah.
So, what would you advise the caregivers and family so that they can be make a part of the society in large?
So the common problems based on my experience, I want to tell you is once a patient came to me who was master's in her subject, and then thereafter she'd done an MBA as well. And the patient then eventually got a job. She did not disclose that she had seizures to her office. And incidentally, she had one such episode, and which was just an episode which one friend observed. And thereafter it is the office who told them that that she should be taken home. And thereafter she came back to me repeatedly. Despite her repeated requests, she was never taken in back for the job. It's very important, this kind of an educational program, that it should be made aware that it is not going to cause any harm to the company who's giving them a job. This is one. Then besides that, when the patients are referred to us, sometimes they are actually pseudo seizures. And we do a lot of psychosocial assessment, and we realize that this pseudo seizure is because of certain family problems that the patients are having. I came across one such patient who was referred to me by Dr. Mamta Bhushan. And this was a 13-year-old girl and who was undergoing some very major personal physical assault. And of course, I reported it after I got to know through my assessment and confirming it through history. So this is another thing that, and
overall,
besides that, they are sometimes asked that, you should not be doing certain jobs. You're not capable of doing certain jobs. So the patients are, they feel very low, they feel very depressed, they feel they're good enough for nothing. So, this awareness program of what you are doing right now is very important, and general public should be knowing about it.
So, ma'am, there is probably what we want to convey is that the society, there is a lot of misconception
True.
and stigma associated with epilepsy. And our
True.
message is that epilepsy is just like any other neurological disorder. And it is not that patient has some mental disorder or patient has some psychiatric problem, and it can be very well treated, and patient can be completely a part of the normal society. And we have seen that many celebrities, many famous cricketers, film stars, or many other painters and famous has had epilepsy, and they have achieved success in life. So epilepsy per se is not any restriction to lead a normal life, and that is the message that society should accept it, and with a proper care and compassion, we should be able to make a epilepsy patient as a part of the society.
Absolutely.
So I'll move on, and then probably one of this common thing is that when the seizure occur, and the patient usually and relatives get very frightened, and even suppose there is a seizure sometime in the road or sometime in the community. So what should be the first care or first aid should be given to the patient, and what precaution a bystander should take? So we'll ask Sangeeta madam to elaborate on that briefly.
Yeah. So the important thing is whenever you see a patient having seizure, so usually the panic comes when there is a grand mal, big seizure, generalized seizure. So stay calm, ensure the safety of the patient. So if there are any tables or chairs which may hurt the patients because he's fallen on ground, remove those, loosen the collar or this thing, and so that his breathing is good. And you may put a pillow under this thing if it is available. And then important thing is many people try, if there is a clenching of teeth, people try to put a finger or a spoon or anything. Do not do any of those things. Also, there is no need to put onion or chapels or anything or to the nose. The seizures usually last from 1 to 3 minutes by and large, and then the patient, its tonic-clonic movement stop, and the patient becomes conscious. Often they have a frothing and saliva, so turn them to a lateral side so that the saliva and that can be come down, and left lateral is more preferable. And time the seizure. So if it goes beyond 5 minutes, or there is an injury during the seizure, or there are fits happening again and again, then there is a time that you have to call the medical doctor or take the patient to the hospital. So that's important that you do this. And when the patient, supposing seizure is over, in post-ictal period also, you have to be careful because patients are confused. They may have vomiting, they may have headache. So just be with the patient, make sure that he's comfortable, and for 1 or 2 hours, take care of the patient that he is safe and he comes out of this epilepsy, that seizure post-ictal phase complete.
So basic message is do not panic, and try to prevent injuries to the patient. Do not put anything in the mouth. And if seizure lasts for more longer period, you have to call the hospital or ambulance immediately. Yes. So we have it running short of time. So now I request a panelist to be brief in their responses. We will go to the very important question about women and epilepsy. So there is always a question whether women can get married with epilepsy, and can they have children and pregnancy? What are the precautions should be taken? So I will request Dr. Mamta Bhushan to briefly discuss this aspect from the patient's perspective.
So from the patient's perspective, I will just take 1 minute. First of all, women with epilepsy do not have to just be obsessed about marriage. Get educated, become financially independent, get a job. Then when it's time for marriage, okay, get married. In the preconception stage, the choice of contraceptive is important. So be aware of that. Discuss your contraceptive if you're using one with your doctor, because there may be contraceptive failure with certain anti-seizure drugs. In the preconception stage, it is better to let the doctor know when you are planning pregnancy. And the most important determinant of a pregnancy in a woman with epilepsy is her seizure freedom. So, you know, your being seizure free is very important. So don't think that the only villain over here is your medicine. The medicine will stop the seizures, which is very important for you to have a good outcome from your pregnancy. And this discussion should happen before you become pregnant. The doctor will choose the drug which is the safest for you, and all women planning pregnancy will also be receiving folic acid. During pregnancy, you should be under regular monitoring. because there may be a readjustment of your drug dose. Sometimes your drug levels also have to be measured during pregnancy. And once you deliver, it is important to remember that breastfeeding is definitely possible. You can discuss it with your doctor, but breastfeeding is safe and possible. And the one thing that you need to remember after you deliver is that sleep disturbance. Once you have a newborn, it is difficult to get enough sleep, and that very frequently leads to seizures. So just manage your sleep well too.
So we can tell that there is no contraindication. All the women with epilepsy can marry and can have children. Only thing is that the pregnancy and the childbearing should be well planned with consultation with your doctor. Otherwise, there is no restriction and they can have a normal children, majority of them, all the women with epilepsy. So that is the message probably we want to convey. We also see that children with epilepsy, usually patients become quite overprotective and they usually they put many restriction on the children. So, Dr. Ashima, what usually you advise, brief advice you will give to the parents of the children with epilepsy? You can unmute yourself.
Yes, sometimes it is the children who are treated differently. So first of all, I'll tell the patients and especially the the parents of the patients, that they have to not treat the person as a patient. So I tell them that it's important that they are treated the same way as other children also. When we are dealing with epilepsy, we're not just dealing with the patient with epilepsy, we are dealing with the whole family. So what is happening is, when there is 2 or 3 children, they will keep on bringing one child back. They are unaware of the ability of the child. They sometimes with either have overconfidence about the child's ability or underconfidence and not let the child perform to the optimum. And the child is sometimes under stress. And the child is constantly made to feel that you are a patient, you are unwell, you're having seizures, you should not be going to school. And the child, rather than feeling, it is one problem that he's had, and doctors are treating him, the child also wants to take a little more advantage of it by taking more attention from the parents, which also causes a lot of disharmony within the family, because the other children feel we are not being treated as well because he has seizure and he's been given more attention by the parents, and not us because we are normal. And
So,
that causes, yes, a
yes,
disconnect between the siblings also.
yes. So basically that what is the advice that they should treat as a normal child,
Yes,
and you understand that there will be some good days, bad days,
yes,
but you need not have to overprotect the child and try to
yes,
lead as normal a life as.
yes.
So we'll
And when
continue.
the child and when the child is normal, so the child will all the other children also treat the child normally in the school.
So briefly, madam, about many patients with epilepsy have this associated depression and anxiety. So what advice you will give briefly to overcome that, or what will be your advice to this patient with epilepsy?
So, first of all, educating them what it is, and depending on the age and the education of the child, and if it's a child or if it is an adult, we kind of do a lot of sessions through which we tell them what exactly the problem is, and we tell them it is normal. It's just like it is just like any other problem, and the problem always has a treatment. And you've come, for example, the institute I belong to, and with a team of neurologists that I have in my institute and the neurosurgeons, I tell them that you're in the best hands. We are from the paraclinical service, and I want to tell you that you're in the best care. And so you please follow your doctor's advice. I also tell the parents, they have a tendency, बहुत दिन तक तो ठीक थे, फिर हमने खुद से ही बंद कर दी. We stop the medicine on our own. So I tell them, please do not refrain from doing this. And even if you think you want to reduce it, you need to come back to your doctor. And if the child is having depression, the doctor would be the right person to send you to the right, maybe a psychiatrist who would be able to give you a right kind of a drug. If it is it is something which needs treatment.
Okay, so basically underlying there is that depression and anxiety both are very common in epilepsy and can significantly impair your quality of life. So if you have feeling of low or not taking interest in the activities, or if you're feeling excessive sleepy or not sleepy, or any other features which you think is depression, or you're very anxious about your epilepsy, always disclose to your doctor, and then doctor will be able to suggest you the proper, even the counseling or sometimes the medicine, and it can be very well taken care of that. So
Absolutely.
to understand that. Now, in spite of good medical therapy, some people have some breakthrough seizures. So we will understand briefly from Dr. Radhakrishnan that what are the factors which can trigger epilepsy and what precaution a patient should take for the better control of their seizure in day-to-day lifestyle modification.
I think this is a very, very pertinent question from the point of view of the patient. As you already heard, that once you have started on a medical treatment, you have to be very regular with the medication, because there are several studies which have been done that in all the chronic diseases, if you follow them up for a period of 1 year, at least 1/3 of the people, at least a few times, would have missed the medicine. This is common for all the disorders. So I usually tell them that even if you forget to take your meals, don't forget to take the medicine. Nowadays, with the mobile phone and other things available, you can keep an alarm. You need not be reminded of. So that's perhaps the most important aspect which we have to emphasize to the patient. And just like the sleep-wake cycle is extremely important as far as the brain function is concerned. So if you know that epilepsy is a brain disease, that it will definitely be influenced by the irregularities of the sleep. So second, perhaps the most important aspect is the regularity of sleep. So I usually tell them that you have to have around 6 to 8 hours of sleep in the night if you are an adult. 7 hours is on an average. It should not be less than 6 hours, and there is no need to take sleep for more than 8 hours. And avoid sleep during the daytime, because it again disturbs the sleep-wake cycle. Perhaps another thing which most of us we don't emphasize, which the patient should understand, is to have a happy mind. Because usually I ask the patient, do you know what is the best medicine for epilepsy? It is not the medicine which have been prescribed to your surgery and all. It's a happy mind, happy and positive attitude. There are studies which shows that a patient's epilepsy will recur if they are depressed or some other condition is occurring. So that as Chaturbhuj mentioned, there are people in the sports arena as well as in the playwrights, everybody who has suffered from epilepsy, eminent poets have suffered from epilepsy. So what is the difference between you, who is too much worried about epilepsy, and those people? Because I usually simply tell them that those people who are successful and have reached the top of their success in the world have made epilepsy their slave. They have overcome it. On the other hand, if you allow epilepsy to rule you, or you become a slave of epilepsy by thinking about the seizure and your other lifestyles which you have not been able to achieve, then the seizures will become difficult to control. And you should also tell them that once in a while, a recurrence of seizure is not uncommon, once or twice in a year. This is more often due to either lack of sleep or missing the medicine. Don't be disappointed by that. This tells you that you have to be more careful about it. And I also tell them that once in a while, once in one seizure, which is happening once in a year or once in 6 months, you should try to learn to ignore them, especially when they are trivial, because and when they are occurring during sleep, or when they are not producing any kind of disability. But please discuss with the doctor also, that he will find out what are the reasons for this seizure recurrence or breakthrough seizures and how it can be overcome. The estimation of the blood level, a change of medication, all these things will be discussed with you. But do not manipulate the medicine of your own. That's perhaps the most important advice you should tell.
So we can summarize: don't miss your medicine, don't stop your medicine without doctor's advice, and maintain a regular lifestyle along with regular sleep and food habits. Those will be the, I think, most important message which we can convey to the patients. Now, finally, coming to our question, maybe we'll have a brief short questions, short answers, 1 or 2 sentences. Maybe one bit for Dr. Bhaskar. Sir, is epilepsy can be prevented, or the normal people, what precaution they should take that epilepsy doesn't occur? So, as a surgeon, I understand.
Yeah, epilepsy can be prevented to some extent. For example, the two-wheeler riders should wear a helmet. Four-wheeler drivers should wear a seat belt, and they should make an attempt to prevent injuries, head injuries. Similarly, people who are vulnerable, susceptible for infections, for example, meningitis, encephalitis, even neurocystic cirrhosis, which Dr. Mamta has mentioned, all those things can be prevented. Of course, lifestyle changes, which Dr. Radhakrishnan has mentioned about alcohol, smoking, drug abuse, and even stressful lifestyles, all of them can be controlled to a large extent, especially pregnant women. If they sort to alcohol and drug abuse, the unborn child also will have to some extent can have brain damage, and then maybe vulnerable for seizures after birth. So again, same like children who are very young children who have very high fever. Fever have to be controlled, reduce it promptly with all the measures so that brain damage can be prevented. Of course, when there is a genetic predisposition as well as structural abnormalities, there is no prevention, but again, genetic counseling may help. Even in structural lesions like people with brain tumors and other lesions, early diagnosis, early treatment may prevent prolonged seizures and then subsequent brain damage and complications.
So, sir, thank you. I would add that probably one is important condition in our India is the birth injury.
Yeah, perinatal. That's what I was
That
going
is
to say.
very important that at least a delivery should be in the hospital and in the proper care so that the birth injury can be prevented. And secondly, all this lifestyle diseases, diabetes, hypertension, they increases the risk of stroke, and that also increases the risk of epilepsy. So if you have a healthy lifestyle, control your diabetes, hypertension, regular exercises, this also help you indirectly prevent the epilepsy. Obviously, wearing the helmet and preventing the infection, taking all these precautions are very important. Thank you very much, sir. So we'll go to maybe one line answer to Dr. Sangeeta. Can people with epilepsy drive? Briefly, can you summarize, madam, driving and epilepsy in our country?
Yeah, so our Motor Vehicle Act is since 1988, and according to that, if you declare that you have a seizure or epilepsy, you are not given the license. But it is in abroad, if 1 or 2 years of seizure freedom, then you can drive. But here, important thing is you have to think of your own safety. If you get a seizure while driving, you may have injured yourself and the people sitting with you. So public vehicle, absolutely, you should not drive, even if you have a one seizure also. But a private vehicle, if you are well controlled, after 1 or 2 years, you can think of driving.
So legally in India, you cannot
It's
drive
not possible. Yes.
But many people, as we discuss, epilepsy can be cured or resolved. So don't drive by yourself unless your doctor advises you.
Yes.
So that is, I think, one message we can give you. One word is from Dr. Ashima. Can people with epilepsy marry? So yeah, maybe yes or no will suffice. Yes.
So we've had these group of patients who came and we worked purely on epilepsy. It was amazing to see. Rather, it was odd when the girls were around in their 20s is when actually the parents brought them for treatment and not earlier. Yeah, so they were very keen. Some of them were very keen to get married. The only thing that we tell them is if you have to get married, you must tell the opposite person and the family that you have seizure. The marriage should not eventually break on this ground that you did not tell us in advance. This
So,
is one take home. Yeah.
so there is no restriction to marriage. Only thing that you need to disclose is beforehand. That is
Yes,
the
yes.
important thing.
Yes.
In
Continue
India,
medication even after your marriage and even during when
Thank
you're pregnant. I think that's also important to tell them.
so moving forward in India, everybody is occupied with the food and diet. And I think invariably a patient of epilepsy will ask you that what type of diet or food they take and whether any particular diet can precipitate seizure. So we'll briefly, maybe 15-20 seconds, we'll hear from Mamta Madam that any relationship between diet and seizure control. You can unmute yourself.
Certain dietary regimes are used to treat drug-resistant epilepsy. That is a separate thing. But for a general epilepsy patient regarding dietary advice, the one question which is asked by almost everybody, whether they can take their medicine on an empty stomach or not. Frequently, patients fast. They keep rosas for the entire month, for example. So do not tag your medicine to your meal. If you feel uncomfortable after taking your medicine on an empty stomach, then you can avoid it. But by and large, absorption of most medicines is better on an empty stomach, and it is not forbidden. You haven't been instructed to only take your medicine after you have eaten something. If that is your choice, sure, you can do that. But you can take something light, a cup of tea, coffee, and just take your. Other than that, there is nothing specifically which you need to avoid. Just make sure that you're having nutritious, balanced food and hygienic food. Other than that, no drinking, obviously, and drug abuse, which is not good for anybody, is not going to be good for you either.
So that's to summarize that there is no effect of any particular food either on the seizure control or seizure precipitation. And it's and in every OPD, I see one patient who has not eaten potatoes for 10 years in the fear of that they will precipitate epilepsy. Please understand that there is no relation. Whatever food you can take, there is nothing, no effect with the seizure control. Maybe one word about from Dr. Sangeeta, whether is epilepsy. Many people feel that epilepsy is a contagious disease. They prevent their child from playing with the other children. So can you elaborate about this, whether epilepsy is a contagious disease?
So I think two-line epilepsy is not a contagious disease. And by staying with an epileptic person, you are not going to get epilepsy.
So we treat epilepsy patient in and out, and if that has been, we all would have been affected with epilepsy. So please understand that. So maybe the last word about the cure of epilepsy. We'll hear from Dr. Radhakrishnan. Can epilepsy be cured, and in what proportion it can be cured?
As you have already heard through these various talks, I think the conclusion would be that epilepsy is an eminently treatable disease. In majority of the people, as we discussed, 2/3 of the people, epilepsy will not affect your life, and the long-term outcome is good. You may be able to come out of the medication. And I usually tell people, unless you allow yourself epilepsy to rule you, affect your life, your quality of life will not be affected. Now, in those 1/3 of the people where epilepsy cannot be controlled by the medication, Dr. Bhaskar has already discussed about the surgical option. After surgery, also a good proportion of patients will be able to come out of the medicine. So if you define the cure of a disease as no symptoms or sign of the disease and not taking any medication for that, in almost 50 to 50% or even 2/3 of the people, epilepsy by that definition is curable. But one thing we should understand is that epilepsy, ultimately it is related to an inherent or a genetic predisposition to develop short circuiting in the brain. So you have to be careful regarding even after medication withdrawal. There are certain lifestyle restrictions like regularity of sleep and other things are required. That is why we call these days a resolution rather than a remission or a cure with respect to epilepsy. Irrespective of that, the last message as far as the long-term outcome of epilepsy is concerned, just like any other disease, in 2/3 of the people, epilepsy can be eminently treated and the medication for that can also be withdrawn. In the remaining lot of advances like surgery or neuromodulation, all these things are coming up. So in the vast majority of the people, epilepsy will not affect your quality of life in the long term unless you allow that to happen. You become a slave of epilepsy.
So to summarize that, in large majority, maybe 60–70% of the patient, either through medicine or surgery, epilepsy can be cured, or they can stop the medicine in the long run. So that is a one good message. So overall, to summarize, please understand that epilepsy is a neurological disorder which can be very well controlled with the proper medical advice and in selected patient with surgery. And majority of the patient with epilepsy can lead a normal life. They can have a normal education, can marry, can have children, and normal job also. So epilepsy should not prevent you in achieving your goal and going ahead in the life. So that will be what is the summary. Maybe one word or one sentence message we can take from all the panelists for the epilepsy patients. Starting from Radhakrishnan sir. Sir, what is the one last brief message you would like to give the people with epilepsy?
I think epilepsy is an eminently treatable disease. You can have your normal quality of life in every sense, as you mentioned, with epilepsy. So be positive in your approach and try to learn to live with epilepsy for some time. And sooner or later, you're going to come out of the medication and other things most of the time.
So accept it and be positive about it. Sangeeta madam, one.
Yeah, so mine is again that you have to come out of the shadow of epilepsy. You have to accept, you have to tell people that I have epilepsy rather than hiding it. And you see the examples of John T. Rhodes or Tony Greig or Napoleon, and everybody had seizure, and Fatima Nasek of Dangal heroine. So all of them have, but they're high achievers. So you can be one of them.
Okay, great. So you can achieve anything what you want in life, even with epilepsy.
Yes.
Mamta madam, one brief message.
Yeah, so for all patients and for everyone, it is just another disease. Anybody can get any disease. So let this not be a stumbling block in your life. Don't make it bigger than yourself. Get treated and just get on with your life.
Okay, so epilepsy is not what it defines you, one aspect of your life, and do not let epilepsy define you. So Bhaskar Rao sir, apart from that, should consider surgery when the drugs are not working.
So if I were a person with epilepsy, definitely I will either take medicines or undergo surgery to cure or control my epilepsy. I hope others will do the same thing. Thank you.
Great, sir. Great. Very nice message. Thank you very much. And one psychosocial as one last brief message from Dr. Ashima.
If one has epilepsy, one should just consider it just another disease. And it is important you accept it. You must communicate to everybody you have a disease and you should not be embarrassed about it. And just live for one day at a time and do not consider about future, what has happened in the past also. Just live one day at a time and things will turn around.
Accept, communicate, and take proper treatment to the patients and provide proper compassion, care, and cost-effective treatment to the patient with epilepsy. That is the message to society as a panel, I think we would like to give. And with that, I would like to conclude this panel discussion. Thank you very much, all of you, for, I think, enlightening us and the people with epilepsy. And I hope it will be helpful to improve the quality of life of the people and improve awareness about the epilepsy all across India. Thank you very much.
Thank you very much.
Thank you.
Thank you so much.
Thank you.